Hi, it's Debbie Seidel-Bickey, and as you probably are aware, we've been talking about the 4Ds, and I created these so that you can smoothly run through your prophylaxis appointment. If it's 60 minutes, you'll see I've outlined it over the last 4 weeks. Today we're going to talk about dismissing your patient, disinfecting the room, and also the patient handoff. What happens, what is said, as you have 5 to 10 minutes to get this all done. So follow me as I walk you through this. I'm not sure if you ran track, but back in my elementary school days, I ran in these relay races. And I'm sure you probably know about this baton handoff. And it is the most important piece of every race. You want to finish well, right? And imagine the baton is your patient. If you drop the baton, you know what happens? You're disqualified. So your best runner is always the last person to hand off the baton. So imagine this last 5-10 minutes of your hygiene appointment is the most valuable. It is a time that you can start to create more value and benefits to your patient. The last person to hand off the baton is the one that makes up the distance that they've lost throughout the race, and they are the one that gives the team the best chance to win. This is a winning position for the entire office when you can hand off the patient appropriately to the front office, create value, and stay on time. The last leg of the race is your anchor. It's true. The first leg, which is called data collection, I spoke about that the first week of May. That's what sets the tone with your patient and the office. It's the impression that's set. It's building rapport. And now your last phase of this treatment is creating future success and a chance to stay on time. At this point, the hygienist and the doctor have completed the exam, and your patient needs to and should understand what treatment is going to be completed at their next hygiene appointment. It was something discussed in the phase prior to the dismissal. And also, what are the restorative needs that the patient has? If they have restorative needs, there will be an appointment discussed for future treatment. And if you have not seen my previous videos and trainings from the month of May, you can go back to last week's and find it at bit.ly/do hygiene treatment. This last phase of your hygiene appointment is the perfect time to create value to what was completed. You can continue creating value, and it may be scheduled and patients need future hygiene appointments and their restorative treatment sooner than later. Your conversation may sound something like this. Mrs. Jones, today I completed your x-rays, and we discovered, as you heard, that you have 2 areas of decay. There are 2 cavities. And doctor wants to see you next week so that she can restore those areas. Doctor is going to use this composite. It's a white type of material that matches your tooth color. And it's just a great method for restoring these teeth. The areas of decay are currently small, and returning next week means that the decay will not become worse, it won't advance, and it won't need more in-depth treatment, which costs more money and time in the office. And because the American Dental Association recommends we treat this amount of decay, I mean, you've got 2 areas of decay in the last 6 months, and so the American Dental Association recommends fluoride to prevent future areas of tooth decay. So I applied that fluoride varnish, and I'm going to send you home with this fluoride gel, which I want you to apply last thing before you go to bed each night. Let me show you how you'll use this And now you'll show the patient, get out their toothbrush. If you're giving them just a regular toothbrush, hopefully before they leave the office, complimentary brush from you, and show them how to put a pea size of their fluoride gel, which they'll purchase from you, and show them how they're going to use this and not rinse with water and spit it all out and rinse it away and brush it away. So explain to them how to use this properly. Explain to your patient that this fluoride is used to stop the future decay. Help them to understand the benefits of actually implementing this preventive measure at home. Then I would go on to explain to my patient, I completed an oral cancer screening today and everything looks great. I also did a periodontal screening. I checked some of those areas last time. There were 5 millimeters and today they're 4. But since you had these areas of inflammation in your mouth plus the areas of decay, I want to see you back in 4 months, not 6. Because inflammation in your mouth can mean inflammation in the body, and inflammation in the body actually relates to other diseases like heart disease and rheumatoid arthritis, even pancreatic cancer and other systemic problems. So I want to prevent inflammation and prevent the decay. So the American Dental Association recommends that we apply the fluoride varnish more frequently, more like 90 to 120 days, and then you continue with the fluoride at home. So you'll need to get another tube of gel when you return, and I'm also going to help you reduce the inflammation in your mouth. I want you to floss more often, especially on that upper right area where we have had the 5 millimeter pockets, and today they're measuring 4 millimeters. 4 millimeters is acceptable. It's within normal limits, but I am concerned that they'll go back to 5 millimeters. So that's why we're going to see you in 4 months. When you return, I will also complete a full mouth periodontal exam. That's where I measure those areas around your gums, and I'll also measure for recession, mobility, and other areas around each tooth. Now, doctor wants to see you next week. Is there any reason that you can't schedule next week to see doctor? Hopefully your patient's going to say, no reason why, let me get that scheduled. And you'll say, yes, I'm going to have Susan schedule that for you at the front desk. Now, I'm going to schedule your next preventive care appointment with me in 4 months. I can see you Wednesday, October 14th at 10 a.m. A little tip for you, if your patient usually comes at 10 a.m. or if they're there at 4 p.m. today, offer them another 4 p.m. or another 10 a.m. appointment. What time they're there today is typically the best time for them to always return. When speaking to your patient upon dismissing them, remember to discuss the what, the why, and the when. What was completed during their appointment, and what do they need to return for? Also, why does the patient need to return next week for the restorative treatment? Why can't they just wait till their next hygiene appointment? Why does the patient need to come back in 4 months for a preventive care appointment? And remember to nix that word cleaning. Your patients aren't coming back to get their teeth cleaned. Hygienists in today's world are providing preventive care to all their patients. And then remember the when. When is that patient going to return? Will the front desk person make their next appointment? Or when will you schedule their next appointment? So remember the what, why, and when. Many times, by the time the patient returns or they get to the front desk, they have forgotten why they need to return. In the front office, many times, I'm sorry to say, but they forget to make the hygiene patient's next hygiene appointment. I know it seriously happens, maybe not in your office, but when I analyze my client data and their key metrics each week, I find many patients leave without a next hygiene appointment. And this is the one area that causes open holes in this schedule, and it just causes your patients to not be returning on time. When you drop your patient off at the front desk, always explain in front of the front office auxiliary Again, you're going to explain what was completed, what needs to be done, and if they are already scheduled for their next hygiene appointment, when do they need to come back to see doctor, and how much time does doctor have, or how much time does doctor need for their restorative care appointment. So remember, the dental terminology that we say amongst each other as dental professional is not your patient's first language. So try to also break it down into words that your patient understands. Did your patient leave with a fluoride gel or a power toothbrush? Let the front office know exactly what was completed so they know and can get the billing correct. If there is a hygiene assistant, they will break down the room and disinfect while the hygienist performs the handoff at the front desk. If you don't have a hygiene assistant, then the hygienist will need to come back to the room, and this is when they'll break down their operatory and disinfect. Most dental offices can text or send each other messages through their computer software, and if you have a patient that needs a longer conversation with somebody at the front desk, then what you can do is send a text message or a simple message through your computer to let them know you'll meet them not at the front desk but in the consult room or a private area, because you want to speak in privacy and be able to answer questions the patient may have. If you already know the patient has more questions and you can't answer them as a hygienist, then somebody needs to discuss those in privacy. And it also can be that they need some financial arrangement questions answered at that time as well. I want you to know that the best way to implement all of this information over the month of May is to take time with the team for a meeting and role play. Everyone as a team role play these various positions. And I want you to know that we at Dental Practice Solutions, we're here to help you implement. And I'm so passionate and I love what I do so much that Dentametrics has provided you a $500 gift certificate to use for a discovery call. And that's 30 minutes where we can actually sit down and show you the most powerful areas to focus on for your best year, most profitable, and without working harder. I hope that you found today's training very valuable and that you find that you have an easier day with your prophylaxis patients in particular, because I know what it feels like to be on a treadmill. Perhaps you've missed our other weeks of videos, but I put it all together today. At the end of the blog, there is an ebook that you just leave your name and your email address and I'll send that to you. Be sure to follow me on my YouTube channel, or actually you can opt in for the blogs, because next week will be more trainings of dental practice solutions for your office. Talk to you soon.